Hello, dear students. Welcome to What, Why, How, the daily initiative by IAS Baba, where we take up a current affair or an editorial and we declutter it in less than 10 minutes. The topic I have chosen for today is one of the editorials that were featured in today's newspaper. It is regarding the TB elimination program in our country. It's titled as India's Winding Road to End TB, because we've had a target to end all forms of TB or eliminate all forms of TB by 2025. So, this is what we are taking up. This editorial we would be discussing in detail, but in a much decluttered form. First of all, you have to understand tuberculosis is an infectious bacterial disease caused by Mycobacterium tuberculosis, and it mostly affects the lungs. The reason why I have said mostly is because there are different forms of TB, and there is a particular kind of TB called as extrapulmonary TB, which is otherwise called as EPTB, that can affect any other organ of the body like your lymph nodes, kidneys, brain, spinal cord, bones, joints, and skin. So you have tuberculosis, which is pulmonary. Pulmonary means related to the lungs, and extrapulmonary, which is related to several other organs of the body. Okay, so this is the first thing to keep in your mind from a prelims perspective. Now, in our country, we have a program called as your National TB Elimination Program, which is under your National Health Mission. I hope you all have seen the video regarding the National Health Mission. So, where it said that several communicable diseases are also dealt with under your National Health Mission. So, TB is one such disease, and according to this target that is there is something that was set called as your National Strategic Plan for TB Elimination by 2025. This was started in 2017, extended several times up until 2025. Now, this program is the chief mission to eliminate TB in our country, which is your National TB Elimination Program. Now, according to this program, we've had few achievements. Some of the achievements being that the TB incidence rate has decreased from, it was almost, I would say, 237 per 1 lakh people in 2015. From there, it has reduced to a 195 per 1 lakh in 2023. That means the rate has decreased by almost 17.7 percentage, or roughly let's put it at 18 percentage. So the occurrence of TB has certainly decreased. But on the other hand, according to WHO estimates, India is the global leader when it comes to the total number of TB cases. Almost 26% of the global cases of tuberculosis reported is from our country. Now, these are all the facts related to tuberculosis in our country. Now, looking as to why we are having such a high amount of cases, why is it that we are not able to cut short the number of cases in a quicker manner? Some of the expert opinions have started off from, see, in India, it's not just tuberculosis that is there. In India, a lot of people have several conditions which make them quite vulnerable to TB. TB is not a very common disease globally if you look at it. But in India, it happens to be so common because in your Indian population, there are several existing or pre-existing factors that make them vulnerable to TB. For example, a lot of industries where you have your mining and stone carving, due to fine dust inhalation, people who work in these industries, which are quite large number of people, their lungs have already been damaged, and because their lungs have already been damaged, they are quite susceptible to TB infection. Other than that, there are certain other contributory factors like silicosis, undernutrition, overcrowding, uncontrolled comorbidities like diabetes. Because of all this, the first stage itself, people become more vulnerable to tuberculosis. The second thing is, once being vulnerable, and if they do catch the disease, the access to healthcare facilities are quite poor. There is a shortage of key drugs in major district centers. Apart from all of this, there's also, if you look at the national TB elimination program also, the focus has always been on pulmonary TB, that is the one that affects the lung. But as I just mentioned to you, almost 24% of the cases that are reported in India belong to the category of extra pulmonary TB. And this is quite difficult to diagnose also. It is not just the occurrence of it, it's difficult to diagnose. It's the drugs that you require for it are much more complicated. So on all the levels, what happens is this extra pulmonary TB is actually ignored even from our national mission. The entire focus of the national mission comes on to your pulmonary TB. Now there is a much more serious problem, because in your district level and in your local level bodies there is a reluctance to notify the disease when it gets detected. Why? Because it will increase the count of TB patients, and this is a bad look for your local administration. So what happens is, even in cases where it could be TB, what happens is practitioners or doctors generally give antibiotics and they try to suppress the disease. But what happens is, this also leads to the tuberculosis coming back again, but at this time it would have gained a certain amount of drug resistance also. So this again is a problematic thing. Then, coming to one of the last major problems, to detect TB, there are primarily two major tests. One is called as your CB-NAT test, which is your cartridge-based nucleic acid amplification test, and the other is called as your TrueNAT test. Both of these are very rarely available at many places, and because of that, also detection of the disease gets delayed. Now the editorial goes about to discuss what can be done. See, one of the first things, and this is something that we did try in India, where there was a very specific focus exclusively on the TB drugs. And at the first stage, the treatment gets initiated in more than 95% of the notified cases. So that is a huge achievement. And once the treatment gets started, exclusively for TB drugs, the NTEP has created a procurement and supply chain system. That means, if at all in any center, if there is a shortage of TB drugs, that gets fast tracked in a much more quicker manner than your other drugs. Apart from that, the editorial also talks about how political leadership must advocate for better TB elimination. If you look at it, none of your major political parties do not feature the spread of communicable diseases or the shortage, or to ensure the drugs for TB. None of these things do feature even in their manifestos. So this is something that the political leadership can take ownership of. And finally, the editorial brings forward a very interesting case study of Vietnam. Vietnam was actually a very high burden country, meaning that they had very high number of TB cases. They have recently shown an effective use of active case finding. That means, just like in the time of Corona, where we had people targeting patient zero and then finding out who were the contact patients, etc. In Vietnam, they did a mission like this, and it worked miracles over there, to the point where the disease burden or the TB burden of Vietnam has reduced drastically. So it has also been said that Vietnam, when it looks at the population density or the condition of people over there, we can have a very similar case to do in India also. So this is something that the editorial tries to take forward. So I hope this editorial regarding TB can function as your base understanding of the condition of tuberculosis in our country. Until we meet again, take care and happy learning.